This is the TD Fitness Podcast with Coach T, episode number 34.
Welcome to the TD Fitness Podcast, giving you ways to live a healthy lifestyle without giving up the things that make life worth living. And now your host, certified health coach and personal trainer, Coach T.
Hey guys, welcome back to another episode here on TD Fitness. This is episode number 34. We're talking about shoulder pain. You can't just shrug it off, right? Before I forget, I do have a freebie for you for this episode. It is the 10-minute exercise routine to help prevent shoulder injury. I'll talk a little bit more about that towards the end of the episode. You know, I guess about 5 years ago now, I took an online course through the University of Pennsylvania. And the course was called The Anatomy of the Upper Limb, because that's what I do. I take courses on things like that. I read, I research, because that's what I'm interested in. My wife gives me a hard time because we have, a plethora of Sirius and XM cable or satellite radio channels, and the one that I like to listen to the most is Dr. Radio. So that's kind of just what I do. I geek out on stuff like that. But what I've learned in some of that research is that shoulder pain is very common. By some estimates, as many as 2/3 of people experience shoulder discomfort at some point over the course of their lives. Now, a few things I think need to be stated right off the bat. The first is that the shoulder is a ball and socket joint. So by definition, there is a very large range of motion. It's not just a hinge joint, if you will, like your knee. It's a ball and socket. So I can move in pretty much absolute freedom around or throughout that ball and socket, just like these shoulder circles I'm doing right now. And because it is the most mobile joint in the body, range of motion is going to remain a key factor in that. And that large range of motion means that there is an even greater chance of injury. So what I'd like to do in this episode is to briefly talk about some of the more common types of shoulder injuries. I want to give you a couple of tips on how to prevent or fix these issues that don't involve serious medical procedures, and basically increase your odds of living pain-free. So the first that I'll talk about is the rotator cuff or rotator cuff pain. And that accounts for, of all shoulder injuries and all shoulder pain, rotator cuff pain accounts for about 66% of all of that. So the rotator cuff is it's a group of muscles and tendons that essentially surround the shoulder joint. The rotator cuff keeps that ball in the center of the socket, the ball being at the top of the bone in the upper part of your arm, the humerus. The ball is at the top of that, and the rotator cuff, again, helps to keep that ball centered in the shoulder socket. It also helps you to raise and rotate your arm. So one of the things, though, that can contribute to rotator cuff pain or injury is performing the same motion over and over and over again. That can lead to inflammation. It can lead to a tear. This actually happened to me about, 11 or 12 years ago now. I was on a military deployment. I remember vividly I was working out twice a day, sometimes with some heavy weight, and many of my movements involved overhead lifts, overhead movements. And I basically experienced an overuse injury, actually overuse injuries with each one of my shoulders. And I was forced to avoid any kind of pressing movements for over 2 months. And if you haven't had a shoulder injury like that before, believe me, you will quickly realize just how integrated and how important having freedom of motion and freedom of movement in the shoulder is to just about everything else you do in your life. You don't realize how much your shoulders play a part in that until you have to go without using your shoulders for a little while. So this obviously limited my workout options quite a bit. I mean, it was significant. And just like much of what I learned stems from mistakes that I made, I wanted to find out why this had happened to me. I mean, I considered myself fairly educated in health and fitness, although I will say that at the time I was not yet certified as a personal trainer. But I started to research why this had happened, why I was injured doing things that I thought were okay. And the biggest thing that I learned about the shoulders is that the shoulder is not a weight-bearing joint, okay? The shoulder is a mobility joint. Remember our discussions on mobility and stability. We've talked about it in episode 7, how the joints in the body moving from bottom to top or top to bottom, however you want to look at it, but essentially in the vertical plane, they alternate between mobility and stability joints. Your ankles need to be mobile. Your knees need to be stable. Your hips need to be mobile. Your lower back and core area needs to be stable. And your shoulders need to be mobile. They're not stability joints. They are mobility joints. But so often we treat our shoulders, particularly those of us who lift weights, we treat the shoulders as a weight-bearing joint by performing heavyweight exercises. I'm thinking the overhead presses, the heavy dumbbell lateral raises, and things like that. There are a time and a place for those types of movements if you are trained to do them, but you have to remain cognizant of protecting the shoulder, because each of those types of movements can cause injury if done correctly, if done too much, and if you're not thinking about protecting your shoulders. So what are some signs that you may have a torn or injured rotator cuff? Well, if you avoid certain activities because they cause shoulder pain, that could be one indicator. If you have difficulty achieving that full range of motion, of shoulder motion, or trouble reaching behind your back, that could be another sign. Difficulty sleeping on that shoulder, on the affected shoulder. If you have pain or tenderness, particularly when reaching overhead, or pain in the shoulder, especially at night, or if you find yourself getting progressively weaker in your shoulder, all of these can be signs of some type of shoulder injury and possibly a rotator cuff injury. So there are some non-surgical things that you can do to improve to help with the shoulder pain. And the non-surgical treatments actually improve symptoms in about half of the people with a rotator cuff injury. And these types of treatments include things like applying heat or cold packs to the shoulder, exercises, obviously, to restore strength, to restore a range of motion, to provide some stability there. I know the shoulder is a mobility joint, but there needs to be some stability in the musculature surrounding that so you can support it. And I'll give you some of those at the end of this episode in the freebie. Also, aside from exercising, you have to provide adequate rest for the shoulders. And this goes for all of the muscles and areas of your body that you work. From time to time, you need to incorporate rest. So resting the affected arm, you could even wear a sling to isolate or immobilize the arm. Over-the-counter anti-inflammatory medications have been known to work. Medical treatments like cortisone and steroid injections have been known to help reduce inflammation. I will say, though, that when it comes to taking things like anti-inflammatory meds or even the medical treatments, I am not advising you to do that. I have to be clear on that. Those things fall in the medical professional lane. I am a fitness professional, so just keep that in mind. So aside from the rotator cuff pain, you may have also heard about shoulder bursitis. So the bursa is basically a fluid-filled sac that allows for smooth movement, if you will. So it's on top of that ball in the ball and socket, and essentially allows for the smooth movement so that when you move your shoulder as such, it's not rough, okay? But the bursa can become inflamed. It can become inflamed when you exercise too much, when you perform too many repeated movements over and over again, you can also experience a shoulder impingement. And the impingement, again, occurs after repeated overhead activity, things like swimming, things like maybe pitching. The shoulder tendons and the bursa can get impinged or pinched between the bones of the shoulder, and it makes it extremely painful. So shoulder impingement can actually weaken the rotator cuff as well. So physical therapy is going to be a key here in alleviating that pain and preventing any further damage. Remember, one of the main jobs of the rotator cuff is to stabilize the joint, right? So any weakness in that rotator cuff and that surrounding musculature could lead to further impingement. And that just creates a very dangerous cycle. So strengthening these muscles, balancing the muscles and the tissues that surround the shoulder, all of that is going to be important to help prevent or to help alleviate that shoulder pain, that shoulder impingement, and even the rotator cuff pain. Now, one other thing that I'd like to point out is that because of the proximity of the shoulder to the neck, if you've ever experienced a neck pain, it can actually manifest itself as shoulder pain or appear to be shoulder pain. And the vice versa, that's also true the other way around. So if you experience shoulder pain, it could actually be something that's emanating from the neck. You have to remember that when it comes to the human body, just about everything is connected. Thomas Myers wrote a great book called Anatomy Trains, and it really does a good job in depicting how interconnected these anatomy trains are, from the tops of our heads all the way down to the base of our feet, and how things that we do and the ways that we move, or how movement is restricted, that can cause pain and limitations in other areas of the body. So when it comes to neck pain and shoulder pain, always remember that those two, because they're very close together, can actually be connected. The other thing that I'll point out that is very important, sometimes you may experience shoulder pain and it may not be an issue with the shoulder at all. So pain in the left arm or shoulder can be a symptom of an impending heart attack, okay? So the shoulder can begin to hurt as a result of the pain emanating from the chest area. So if you think you're having this type of pain or having a heart attack, other symptoms include tightness in the chest, pressure in the chest, hard to catch your breath, sweating, nausea. I want you to seek medical attention, because that could be something way more severe than shoulder pain or shoulder injury. Now, let's talk about a few general treatments, and I've already mentioned most of these when it comes to shoulder pain, though. So rest is going to be a good one. I've talked about that in the past. In addition to exercise, rest is also an important concept, right? It's to use a simple example, when it comes to interval training, the whole reason that intervals are effective is because there's a rest period put in there so that you can work hard for a separate period of time. And the same is true no matter what your intensity and no matter what type of exercising you're doing. You want to incorporate some deliberate rest, okay? So resting the shoulder joints is going to be important, just like rest is a fundamental concept when it comes to exercise. I mentioned ice and heat, and each of these serves a good purpose when it comes to having that acute shoulder pain, because each can provide relief in different circumstances. I talked briefly about pain relievers, physical therapy. The thing with physical therapy is that it's only good if you do it, right? And that is really the one of the biggest issues with, and I've been there myself, but one of the biggest issues with physical therapy being effective is that we just don't take the time to do it. But understand that those exercises, those movements, those things that are prescribed by physical therapists all have a purpose. They may not seem to be doing a lot, for, in the moment, but over time, they are indeed helping to alleviate your situation. And then I mentioned also cortisone to reduce inflammation. And I would be remiss if I didn't mention the stretch and strengthening aspect of this. So we talked about strengthening a little bit when it comes to exercise. And again, the freebie that I'll provide at the end of this episode is going to have some of those strengthening exercises, but stretching is also important, okay? Because if you don't have an adequate range of motion, then your body's going to try to compensate. And when it tries to compensate, that could lead to injury. So you want to stretch to maintain that adequate range of motion in your shoulders so that it has full mobility. Also, I want you to call your healthcare provider if you have shoulder pain with a fever, you have any kind of swelling or redness, if you have problems like moving the shoulder, if it physically will not move into or from a certain position, that's an issue. If the pain lasts for more than 2 to 4 weeks, even after you try some of these things that I've mentioned in this episode, then you probably want to seek some medical attention. If you notice visible swelling, that's another indicator that you want to go see the doctor. Or if you have discoloration, red, blue color of the skin in that shoulder area, those are all things that are probably outside of the self-help area, and you want to seek some medical attention in that case. Now, let me leave you with a couple of takeaways before I hit another topic here. The biggest takeaway, and I mentioned it early on, is that I don't want you to treat your shoulders like a weight-bearing joint when you're exercising or lifting. Don't go heavy on the shoulder raises. The shoulder raises are not meant to build shoulder muscles for competition. Those shoulder raises are there to strengthen the rotator cuff, okay? When you perform lateral raises, I've seen so many people do this, performing these straight out to the side. And when you do that, particularly with heavy weight, you put your shoulder in a very precarious position. So you can change that movement just a little bit and achieve the same effect by instead of lifting the weight directly out to the side, just move your arm about 30 degrees forward. It achieves essentially the same movement, but it takes the stress off of the shoulder at that lateral position and reduces the chance of injury. Also, it's okay to go overhead, but you don't need to overdo it when you do that. You don't need to go extremely heavy. Realize too that my audience here, who I'm talking to, are the folks that kind of fall into the general fitness category. That's me. Okay, that's me. That's probably you. If you are a bodybuilder or a competitor, then you probably want to seek advice outside of this particular episode when it comes to the shoulder, because you may need to go big, you may need to lift heavy. I'm not talking to that group of people. I'm talking to the people who want to avoid injury, want to perform the activities of daily life, and want to maintain a general fit livelihood and exercise routine. So again, it's okay to go overhead, but you don't need to go extremely heavy when you do that. And certainly don't do it repetitively, okay? Now, another important takeaway is that you should work all parts of the shoulder in different dimensions. Avoid those precarious positions where, like I said, where your shoulder is essentially in the weakest state with a lot of heavy weight, the lateral lifts that are directly out to the side and things like that. You want to maintain a good range of motion, but not too much, not too loosey-goosey, but you want to have the range of motion. You want your shoulder to provide the correct range of motion so that you can, again, perform the activities of daily life. The best way to manage shoulder pain is to avoid it in the first place. And that's the whole reason why I'm giving you some of this information in this episode and providing that freebie at the end of this episode, okay? Also, the best predictor of shoulder injury, just like injury anywhere else in your body, is a previous injury. So understand that if your shoulders have gone through some trauma in the past, if you've suffered some type of shoulder pain in the past, you are more susceptible to having an injury in the future. So just keep that in mind. Now, as a side note, as a population, our collective postures are just getting worse and worse over time. Some of it has to do with the fact that we are constantly either over a computer screen or head down, checking our cell phones and whatnot. Those things affect our posture. And posture problems dramatically increase the risk of shoulder injuries. You may not equate those two immediately, but this is a very important concept. So when your posture tends to suffer or starts to become less than optimal, I'll say, what happens is the muscles in the front of your body start to move forward. They start to contract because this is where you're spending the majority of your time, right? With the head down or head looking at a lower computer screen. Your shoulders are then going to come forward. This means the muscles in the front part of your body are going to get tighter, progressively tighter over time. The muscles on the back side of your body are going to get weaker over time because they're constantly being stretched. So this posture here in itself makes the shoulder weaker. So one of the things that you can do is raise your mobile device to eye level from time to time rather than tilting your chin down all the time. Another thing you can do is to make sure your computer screen is at eye level at your desk. A concept related to this is the fact that we tend to exercise the muscles that we see in the mirror. So many of us will tend to exercise those muscles on the front of our bodies, the pretty muscles they call them, right? The biceps, the chest, the abs, those are the things that we can see, all the while neglecting our back and posterior chain. And this can create an imbalance that, again, pulls the shoulder and other structures forward, contributing to injury. It's crucial to balance this out by strengthening the muscles of the back and maintaining good flexibility all around. Okay. So one rule of thumb, something that I tell people when I speak about this, is that for every action, every movement that you're going to perform that targets the front side of your body, for example, if you're going to do push-ups or bench press, perform twice as many pulling exercises as pushing exercises. And that's because we spend so much time neglecting our rear muscles, those muscles on the back side of our body, and again, our posterior chain. It's that our postures are so far forward, we really need to work to get our shoulders back, head up, and make sure we're in a balanced and stable position. Posture and balance are both important. All right. So that's all I have for the shoulder episode. I will say, though, that over the last 3 episodes, what I've tried to do with each of these episodes in this common pain series, I'm calling it, where I talked about the neck, the knee and the shoulder. I'm sorry, the lower back, the knee and the shoulder, is I don't want you to underestimate the things that you can do to prevent and even fix some of these common pains before taking any medical action like medication or surgery. There are certainly times when surgery or more precise medical advice and action is warranted, but understand that healthy living and smart exercise and movement go a very long way. Okay, that's kind of the biggest takeaway from these last 3 episodes. So I'll stop there. I did want to remind you again, though, that there is a freebie for you to download for this episode. It's essentially a 10-minute exercise routine to help prevent shoulder injury. You can get that at tdfitness.net/034 download. And the show notes for this episode you can find at tdfitness.net/034. There you can grab the freebie. There you can read the transcript. You can listen. You can watch this episode however you want to consume it. And there will be links to all of the references that I mentioned earlier. As always, I want to thank you all so much for tuning in. Have a blessed one. Coach T, out.